present here virtually. A very good evening to all our dignitaries, President of IFWA, the board members, members of different University Women's Association, and Dr. Ranjit Chakraborti, our resource person for the day. I'm Meenakshi Kulkarni, Secretary of University Women's Association, Nagpur, and it's my privilege and pleasure to welcome you all on this virtual platform. We will begin with a shloka to invoke Goddess's blessings and pray for her presence amidst us. Today, to help us go through all the perils of life, we pray for those friends and acquaintances of ours who are suffering from physical and mental stress, and offer our sincere sympathies to families of those members whom we have lost in the last 2 years. I will recite the shloka. Ya Devi Sarva Bhuteshu Matrurupena Sanstita Namastasai 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 Namo Nama. The meaning of this shloka is the Ya Devi Sarva Bhuteshu mantra is part of Devi Stuti or salutation to Goddess Durga. The mantra is a liberating composition praising Ma Durga. The mantra thanks the omnipresent consciousness for the existence of life. It invokes Durga Ma and asks for her blessings to lead a positive light without any obstacles. O omnipresent Goddess Durga, who has nurtured all beings in the form of a mother, I bow to you, I praise you, I revere you again and again. The sense of motherliness and motherly feelings that are present in all beings are a form of the Devi, the Divine Mother. The topic of the webinar is Health Crisis of Women with special focus on hormonal imbalance. Medical scientists have been studying the human body for hundreds of years, yet many things that happen in the body still remains unknown to even the most talented professionals in the medical industry. There are quite a large number of substances in the body that are essential to life. Hormones in particular play a pivotal role when it comes to the function of the human body. Thus, also possesses as quite an interesting area of study for medical scientists. Present-day women encounter hormonal imbalance, probably because of continual stress, unrealistic expectations in all areas of life, and inadequate guidance on hormones, which have given rise to a health crisis in most of the women. We often associate the role of hormones with changes occurring in body during puberty, pregnancy, and menopause. However, hormones have a wider role to play towards body growth, development, metabolism, reproduction, and mental health. We are often told by our elders that it is normal to feel fatigued, stressed, fatty, and cranky with our growing age. But this isn't true and it isn't normal. Today, we are fortunate to have with us Dr. Ranjit Chakraborti, who will enlighten us in this area. I will announce the housekeeping norms for the smooth flow of the program. All audios are to be on mute. Videos may be provided. It does not hamper technical smoothness. The members can ask questions to the resource person by typing in the chat box. The question will be taken up after the presentation or can be put up directly to the speaker at the end of the session. Now I request IFWA President Dr. Anjana Banerjee to deliver her opening address. Madam.
Thank you, Meenakshi. On behalf of the Indian Federation, I once again welcome our resource person of this evening, Dr. Ranjit Chakraborti, and all my sisters from the different UWAs who have joined us today. In the present times, we have been noticing that there is a lot of chaotic situation going on within a woman's body due to the hormonal imbalances. Now, truly speaking, we are not really aware, and we would like to be aware what all factors are culminating in this hormonal imbalance, leading to a lot of stress situation in the life of young girls, middle-aged, and even for the senior citizens. We need to keep our body and mind in the best of conditions to carry on our day-to-day work, for which healthy well-being of the body and the mind is a very important factor. This evening, we are privileged to have with us a renowned gynecologist in the name of Dr. Ranjit Chakraborti, who will take us through this journey and help us to understand the different nuances of hormonal imbalance and its effect on women. Over to you, Meenakshi. Meenakshi.
Thank you so much, madam. It gives me immense pleasure to introduce our erudite speaker to the August gathering. Dr. Ranjit Chakraborti is a senior consultant in obstetrician, gynecologist, and laparoscopic surgeon. Dr. Ranjit Chakraborti did his MBBS from Medical College, Calcutta in 1984. After his graduation, he completed diploma in gynecology and obstetrics in 1989 from National Board of Obstetrics and Gynecologist Society. He has done his certificate of completion of specialist training from STA and RCOG London, UK. He joined as the resident house staff anesthetics at Medical College and Hospital, Calcutta. He was the resident postgraduate trainee for a year from 18th January 1988 to 17 January 1989. He served as the resident house surgeon, Medical College and Hospitals. He was the acting registrar at St. Mary's Hospital. He was the senior registrar obstetrics and gynecologist at Princess Margaret Hospital, SWINDON, Wills University. Now I request Dr. Ranjit Chakraborti to address us. His talk is going to be very valuable for us, as he will tell us about the importance of health crisis of women with special focus on hormonal imbalance. I welcome you, sir.
Thank you very much. Good evening, Madam President and Madam Secretary, and all the members who have managed their time to join us in this webinar. Thank you all for allowing me this opportunity, even virtual, to meet you. And I wish once the pandemic is over, we will certainly have another occasion where we can be physically present inside a hall or somewhere to discuss it. Now, today's topic is very important in women's life. And as Madam President mentioned, I also think we should divide it into three halves. One is for the young teenage girl to the young reproductive age group. Second group will be the middle-aged woman. And third will be perimenopausal and menopausal women and their problems. Today's talk will be mostly guided by hormonal imbalance and its effect in normal ladies' life. Before I start my talk, I would like to explain when a girl becomes a woman, what really happens. Inside the brain, there is a place in the brain called hypothalamus. This hypothalamus matures with age and then starts sending signal which your ovaries start responding to. That is how a young girl becomes a young lady. The first period, we call it menarche. Menarche starts. So it is the hypothalamic pituitary axis which works cyclically as a biological clock and makes all the normal activities of a woman's menstrual life, their fertility, and even their menopause. So now, if I address the young group of young ladies who have just gone through menarche and are becoming slowly entering as a young reproductive age group, they are nowadays suffering badly with a condition called polycystic ovarian disease. You might have heard about this because I'm sure many of you have young children and especially young girls who suffers badly, and they complain that once they start their period, since then they are having irregular cycles. Some of them are becoming obese and they are not really having regular periods. They also see a lot of external changes like acne, abnormal hair growth in body, and they are confused that what's going wrong with them. So these are the people who needs medical attention. So if you have a young girl or a young girl relative of anybody and they complain about this sort of symptoms, you should let us know, consult with any gynecologist, and by a simple ultrasound test and some blood test, we can figure out that whether she is suffering from polycystic ovarian disease. Now, don't get scared if you heard that somebody has got this disease. This is completely treatable, but the problem is this disease tends to stay with the lady, and when they become in this early reproductive age group, they sometimes hamper early childbirth. So what you need to do is guide them with dietary advice, exercise, and medications as and when required. So polycystic ovarian disease is a burning issue for all teenage girls in today's society. Almost 25 to 30%, that's a big number, of these young girls, they are affected with this disease. So now I will take the discussion slightly forward in the age group of childbirth. Now what happens is, once a woman gets pregnant, there is a lot of changes of hormone happening in the body. The normal hypothalamic pituitary axis is shut down and the system is flooded with the hormone produced by the placenta. Placenta is the place which anchors the baby with the mother. Now these placental hormones,
Kindly keep your mics muted, please.
93 pieces লাগবে।
Okay, I can clearly.
Uma madam, can you please mute yourself?
I'll mute her. I'll mute her. You carry on, please. I'll mute her.
Yeah, can you hear me clearly now?
Yes, please.
Okay, so I'll continue.
Yes, please.
So now the question is, what are the crises happening to the young ladies who become pregnant? Now, this huge hormonal changes the body in a very short time, as well as the mind. So you might find there are some ladies who are unable to cope with these huge hormonal changes, especially the mood swings of it. You may have noticed that in pregnancy, the tolerance to normal level, the mood changes happen in a way that sometimes the woman, they feel depressed, they become tearful. Also, sometimes they can get agitated. Now, we, the family members and doctors, we need to consider this as a crisis of hormonal changes, and without challenging it, it's our responsibility to give them the mental support they need. Now, after the childbirth issue is gone, there are some ladies who faces tremendous depression, pregnancy blues, and I have seen in my life such extreme cases that mother is not wanting to hold the child or feed the child and doesn't want to even touch the child. which she desired for such a long time. So if you ever noticed anybody in pregnancy time, they are getting this pregnancy blues, depressions, or they are tearful, please bring them in our attention. They are treatable with some light medicine and counseling, and they need care and attention so that they can enjoy the childhood. Now, after this childbearing age comes the most crucial stage of a woman's life, which is middle age. By then, the career for everybody has reached a place which is becoming very challenging. Most of you will be holding very important posts and responsibilities, and the pressure from the family and looking after the children, that also becomes immense. Now what happens is, this hormone axis which I was explaining to you, which gives women their normal period cycle, this can get disrupted in this middle age time. What resulting into abnormal bleeding, severe period problem, and lot of issues as if there is disease of the uterus. So if suddenly you notice that your period cycle has changed, you started having heavy period, painful period, you should always take a help of a gynecologist, because some of the time they are due to diseases like fibroid, adenomyosis, endometriosis. These are different diseases which I don't want to get into today's discussion at all. But what I am trying to say is, if you ever face that your normal period pattern is changing for worse, you should always get it investigated. Another good idea, which in our country, a lot of women are not availing, is a well-woman checkup. I know we are discussing gynae problems only, but there is another issue of burning problem of breast cancer in our society also growing up. And breast cancer is #1 position now in female cancers, and this is something which can be covered in a well-woman checkup. So my advice for all women in childbearing age, middle age, and upwards, that you should always once in a year come for a well-woman checkup, so that we can detect these problems and we can give you a solution, and sometimes we can even prevent you from a dreadful disease if we can catch it much earlier. So for the middle-aged group, if you see anything regarding your period pattern changing, please don't expect that all the times there will be a issue in the uterus or the ovary. Sometimes when you do ultrasound, you find everything is normal. Blame it for a disease called dysfunctional uterine bleeding. You will be surprised to know all over the world, still today, 65% of hysterectomy, means removal of uterus, operations are done due to this dysfunctional uterine bleeding, which is not caused by any tumor or any other disease. It is just a result of untreated or delayed treated dysfunctional bleeding causing by severe hormonal imbalance. Now, I'm sure you have some questions in mind. I will try to answer it at the end of the meeting, and you are most welcome to ask me any specific question on any topic you want. Now, the third part is the most important part, is perimenopausal changes. Like I told you, once this little girl becomes a woman, that first period is called menarche, and the changes in body happens over a few period of years. It's called puberty changes. Menopause is also a phase of life which comes from 40 to 50, and that is something most women are very afraid of, that I am going to go through menopause, what will happen to me? How will I survive? There is a very interesting medical history when I was studying in hematology. You know, in Roman time, there was nothing called menopause. I was surprised to know why. Because of childbirth, because of war, most of the women used to die by the age of 55. That was their average age. And in today's society, the average age of living is around 85. So about 1/3 of your life, you are going to be in the phase of menopause. So it is very important we understand what is going to happen when we approach menopause. And we also have to have a very clear mind not to get stressed up that menopause is coming. Everybody has fear of menopause, and whenever I talk to any perimenopausal lady, they are all scared of the complication. Now, what is menopause? Menopause means the menstrual cycle stops. Pause of menstrual cycle. Why does it happen? It happens because the ovaries slowly stop functioning. The eggs, the ovums, which are loaded on a child's ovary, slowly gets exhausted, and there is no more ovulation happening, and the ovaries tends to slow down their action and starts drying off slowly. So what happens? Your period stops, but most important is the ovarian hormonal function, they get disturbed. Now, ovaries produce two main hormones. One is estrogen and the other one is progesterone. Estrogen is the hormone which makes the woman beautiful, which makes the period happen, which makes uterus ready for conceiving in every cycle. And with less amount of estrogen produced, there are also going to be some physical and mental changes coming up. First, lot of people, lot of ladies, they notice that there is a hot flush. It's a hot sweat almost suddenly coming even in middle of winter, and it comes through on the back of the head, ears, neck, and it stays for a few minutes and it goes off. So if you start feeling hot flushes, that is something you should take notice and you should come for a checkup, because there are a lot of things we can help you to deal with your menopausal changes and menopause. Next is, a lot of people notices urinary symptom and vaginal dryness. Some people complains of skin texture to be deteriorating very fast. And also, most important thing, mood changes starts happening. A lot of people shows less tolerance, irritability, and even the family member starts complaining at this time, especially the children, that they are getting scolded. Look, these are the normal changes which does not last for a very long time. So if you are having these symptoms, don't get upset. Now, what are the remedies to deal with this menopausal symptom? First is lifestyle. All of us, we spend time for education, career, children, finance and everything. Most of us don't have time for ourselves. The machine, which is our body, that also needs some care and servicing. So concentrate on your diet at this age. Try not to have too much fast food, too much oily and fatty food, and too much sweets. Having a balanced diet often helps handling menopause in a better way. Especially products like soybean, soya milk, that sort of thing, they are very helpful. Number two is, if you are not into regular exercise, this is the time you should start adding at least 45 minutes of freehand or any sort of exercise with your lifestyle. Number three, medicine. You all have heard there is a magic medicine called hormone replacement therapy, HRT. In about 20 years ago, the Western world thought that it's a magic medicine. Any woman who is going to face menopause, give them this hormone replacement therapy and they will get relief. That concept has now changed. We only use hormone replacement therapy for a very short time just to give you relief from the immediate effects of menopause, like hot flashes, dry vagina, and that sort of thing. We rather try to impress lifestyle changes to adapt with menopausal changes. And there are supplementary medicines made from soya, made from evening primrose oil, which can help menopausal symptoms in a great way. And one thing I should tell you, that menopausal symptoms which you face, once you start facing, don't give negative thoughts in your mind that this is end of life. Your life will still have another 35 years of period without this period. And it is not essential to have period to survive a normal life. It is just the change of life, the lifestyle which you need to adapt to help you cope through the menopausal symptoms. Another thing I should impress on you again and again, that please develop a habit of once in a year well-woman checkup. And I will always tell that self-examination of breast, pap smear of cervix, and a routine ultrasound done in 2-3 years difference can pick up a lot of pathologies happening due to menopausal changes. Most important thing, ladies who have gone through menopause already, you should not think that your gynecological need is over. Rather, you should come for all the supplementary helps like calcium and vitamin E and other essential elements which you require to have strong bones, because bone loss after menopause and during menopause is a serious problem and causing multiple fractures when you become old. And if you ever see bleeding coming back after menopause, that is something you should bring in our notice as quickly as possible. This is called post-menopausal bleeding. And why does it happen? It can happen due to a lot of changes in the cervix and the uterus, but some of them are beginning of a change called endometrial hyperplasia, and which can cause endometrial cancer-like diseases in future. So don't get scared. All these things doesn't happen in one day. And if you notice any sort of abnormal bleeding like this after menopause, you please bring it in our attention as quickly as possible. So how will you consider that you have gone through menopause? At age of 45 onwards, if you have a period of no bleeding for 6 months at a stretch, you can think of menopausal changes happening in your body. Now, instead of talking about diseases any further, I think I will leave it to the floor for any specific questions you have or any other topic in this subject you want me to elaborate more. And I will really thank you for giving me this opportunity to interact with you and all your members. Thank you very much. And I will be open for any question, Madam Secretary, as you wish.
There is a question in the chat box. What can we do to prevent breast cancer?
Very good question. So I think first thing is that every woman, once they start having their period onwards, especially the girls, the mothers or their sisters, they teach them how to maintain personal hygiene. You should add examination. It's called self-examination of breast. Now, self-examination of breast is something which you need to do once in a month, and you do yourself, and I can show you how to do it. And that is something which prevents and detects ovarian breast diseases earliest. Number 2, cigarette smoking, unfortunately, is going slowly high in ladies also. Nicotine is a known cause of breast cancer enhancement. Number 2 and 3 is who are married and who have children, we should encourage them to breastfeed. It has been noted that if you have completely breastfeeded two child completely breastfeeding, you have much less chance of having a breast cancer than the normal population. Number 4, use of unsupervised medications like oral contraceptive pills, even in menopausal time, using estrogen pills unsupervised. Now, unfortunately, in our country, you can go to any shop. If you know the name of the medicine, most of the places you can buy it without a prescription. That includes pills, medical termination tablets, and even HRT tablets. So I will insist to all your members that do not use medications of hormonal origin without a gynecologist supervision. So to sum up, breast cancer can be detected and prevented if it is dealt with in the very early stage. And number 1 is self-examination of breast. Number 2 is a routine one-woman checkup, and 45 and above, or you can start from 40 and above. 1 ultrasound in a year to look in the breast will detect most of the breast diseases and cancer. And one thing it is good, well, there's nothing good in cancer, but one thing is good in this organ is it is outside the body. So if you could detect the disease at its early stage, 99% of women can have a normal life and will have no lifespan problem with having a breast cancer detected or even having a surgery done. So please examine your breast regularly once in a month. I think I will enhance on that only.
So the next question is, thyroid disorders are very common nowadays. How can we avoid having them?
Now, there are 2 types of thyroid disorders. One, we commonly call the thyroid which puts on weight. That means the thyroid gland is functioning less, which we call hypothyroidism. That means your thyroid gland is not producing enough hormone as it is required. Now, there is no such thing called how you can prevent it, but it has been shown very clearly that young girls, which I discussed earlier, who have polycystic ovarian disease, tends to have hypothyroidism at a very early age. So from the teenage, it is very important to identify polycystic ovary, check unnecessary growing fat. That means if you see there is a sign of obesity in a young girl, they should be controlled with exercise and healthy diet. And if you can keep the polycystic ovarian disease under control, you will have very less amount of hypothyroidism in future. There's another thing coming with it. This polycystic ovarian disease group of patients, they not only have hypothyroid, in later on in 40 plus life, they have diabetes. So these 3 are friends: polycystic ovary, hypothyroidism, and diabetes mellitus. So it is very unfortunate that today's teenagers, we are living on fast food, and the fast food, due to convenience for parents and for everybody, and obviously it's delivered at home within a few minutes once you order it. So our children are growing on fast food. Second, this pandemic has made it worse. We don't have places for our children to go for physical exercise or playing. Less playing and playing on video or on mobile does not help the body to shed weight. So I will consider from the school going age to consider diet, body weight and exercise that can reduce chance of hypothyroidism later on in life also.
So the next question is, after menopause, women tend to put on a lot of weight, especially around waist and tummy. How to control that? Is there medication to take to control it?
Well, I will definitely say it is a very known fact and we call it a middle-age trait. It happens for men, women both. What happens is our body metabolism also changes with our age. So here comes the role of diet. According to your age, you need to change and modify your diet also. When you are teenager, college going, or you are early in your career, you are doing a lot of running around and your body metabolic rate is high. So if you don't take care of food, you can still manage. But with menopause onwards, you have to ration your food and especially enhance on diets like milk products, which is rich in calcium, and lot of fruits and vegetables. And second, most important thing is you need to bring exercise into your lifestyle. Because if you don't reduce your eating, your burning out of calories is already going down slowly. You are burning out less calorie, your metabolic rate is going slow, and you are eating the same food, you are bound to have weight problem and this deposition of fat. So modify your diet. If required, talk to a dietitian or any sort of exercise you feel comfortable with. It can be 45 minutes, at least 4 days in a week, and that should do the trick.
So the next question is how to identify vitamin B12 deficiency post-menopause.
Now, not only vitamin B12, I will tell you to identify deficiency of 3 things. One is calcium, one is vitamin B12, and one is vitamin D. Unfortunately, we are lacking B12 and vitamin D very much. B12 is very important to be checked for people who are vegetarian. So if you are a strict vegetarian, in a year or in 2 years, please check your B12 level. There is very little physical indication that happens quite late. Sometimes you tend to get ulcers in your tongue or sometimes small angular ulcers on the side of your lips. But those changes happen with severe B12 deficiency. So basically you have to have a routine once in a year checkup when you will do your lipid profile, you will do your calcium checkup, B12 and vitamin D checkup. That is the best way of dealing with it.
So the next question is, why do we see the proliferation of fertility clinics? Is it only because of women's hectic lifestyle?
That's a very good question you have asked me. I address this issue when I am talking to a crowd regarding infertility or any sectors of that. Now, few things have happened in society. Life has become very competitive. So, our studies and building career obviously is the first priority. So, this, especially in this urban population, that means people who are living in big towns and cities, their age of marriage is getting deferred. Number 2, even if they have married in right time, there is pressure on them either at work or at family to get them settled financially. So we are more and more getting people coming to us asking or planning for pregnancy at a much later age. So the childbearing group, which is supposed to be 21, 22 to 30 in cities, have shifted even after 35, 37, and I quite often get couples who are around touching 40, and now they are ready for children. So that is one reason, and one very good big reason of these infertility centers coming up. Because some of the people, they know they have got delayed, so they don't want to waste time. And like all business, infertility clinics are also a business which have a lot of client base in big cities. And with this number of couples marrying and getting prepared for a child at a later age, they are taking the help of infertility lab sooner than later. So this is one big reason of this happening.
So the next question is,
May I ask Dr. Chakraborti one question?
Yes, madam, please.
Dr. Chakraborti, I'm just trying to ask you that not only menopausal women, but women of my contemporary to me in the age range of mid 60 to 70, they have a particular sleep problem.
Yes.
Is it because of hormones? I mean, we know that we are always told don't take screen time, don't eat caffeine. That is all we know. But even then, those who are not into all those practices, either they're taking time to fall asleep or they're waking up very early. Is it because of hormonal imbalance?
Madam, one thing, the hormone is, the estrogen level is gone. There is very low level of estrogen. But the sleep is maintained by a chemical called melatonin in brain. Now, with age, the secretion of melatonin becomes slightly less. So you will see elderly people who are 60 plus, men or women, they suffer from insomnia and they have very short period of sleep. In family, in a joint family, you will see the parents, the elderly parents, grandfathers, grandmothers, they are waking up early in the morning. So yes, it has some issues with melatonin production due to lack of estrogen. And second is the stress of work and life. And if you are thinking too much about your life, about your problem at work and things, and if you bring that home, that also doesn't help in sleeping. And insomnia is a killing problem in our present society. So you have noticed it right. Though it has got some effect of lack of estrogen, but mainly it has to be a lifestyle.
Insomnia is a big problem to many in this age range.
Yes. And second thing, I can suggest one thing, that your body needs to be tired also. So add some exercise in your lifestyle. If you can burn out some energy regularly, you will probably have a better sleep than a sedentary life. So exercise has a good role in it. And obviously, you know the tricks that don't have coffee or alcohol late in night. And especially if you are a coffee drinker or if you are having too many cups of tea, finish your last cup before early evening and don't have it too much late in night. That caffeine also keeps stimulating the sleep center.
Madam, can I ask the next question? The next question in the chat box is how to identify vitamin B12 deficiency.
Now, identifying B12 deficiency, as we discussed earlier, is not always very easy because sometimes tongue ulcer, mouth ulcers, and skin problem comes with B12, and especially it is the vegetarian patients who suffers from B12 deficiency. So if you are a vegetarian, you should once in a year check B12 level to identify the deficiency. That is a better way of doing it than waiting for any symptoms to happen.
And can you suggest some alternative, like the vegetarians, if they can include in their diet, sir?
Now,
basically, B12 deficiency.
Basically, we are not going to name any medicine here because
no, not medicine, in the diet.
The diet, yeah. So basically, what you can do is take lot of green vegetables, salads, leafy vegetables like lettuce and spinach and that sort of thing. And always, if you are 40 plus, add dietary supplement of there are multiple preparations in market which supply quite a few B complex and other group of vitamins, including vitamin C also. So take a dietary supplement and change your diet to more leafy vegetables. It will help you out.
So the next question is, when women start their menopause, is it so important to give an understanding husband and family? That is what the woman wants so much when she's going through such mental stress and has and migraines.
These are called vasomotor changes. And I can tell you one thing, doing gynecology practice for almost 30 years now, families, even husbands, tends to underestimate this problem, and children don't even understand it. But this is so severe that I think the family needs to be counseled. Now, most of the time, the family does not come to us, the doctors, when the patient is visiting. So what I will advise you, if you are suffering with menopausal changes, if you have come to visit us, we will advise that take a cup of tea one day with the whole family and explain this, that there are some changes happening due to age, which makes people irritable for a short period of time, and this period is not going to last forever. One good thing about menopausal changes is they last for 2 to 3 years, and after that, they tend to disappear. So if you are irritable now, if you are having mood swings, tell also yourself and do self-counseling and tell your family that this is just a phase which is going to pass over. But yes, you have hit a point right, because family members don't understand your suffering. So it is our responsibility to explain this to them, that look, this is not just you are making a fuss of it. It is happening and you are suffering with it. You need a little more consideration, because you have wasted your whole life for your family and family members. So they need to be a bit compassionate, and just this is a year or two and it will pass off. So I think that is the best way of dealing with this problem. Talking to the family members. We always try to explain to the family members who have come to our clinic with the patient, but we hardly could see the whole family. So this is the message to take home, is counseling of the family members is very important in this.
So the next question is, what is an ideal diet?
Now, ideal diet for different human being is going to be different. Diet is a big science now, like medicine. So it all depends on your body build, your height, your weight, your age, your status of your hormonal. If you are an early woman and if you're suffering with polycystic ovary, your diet will be less fat, less sugar, and the balanced diet has to include lot of fruits, vegetable, even green salads, which in Western world, it is much easier to get. And even if we get it, here we don't highlight in our diet of producing raw fleshy vegetables and salads. Then next comes milk. Fortunately, in India, all households are used to have some form of milk or milk products or curd or chena, whatever it is. So for a woman, it is always necessary, because they have bone loss from the perimenopausal age, to have milk and milk products added to it. Now, if you are a non-vegetarian, then the suggestion is don't have too much of red meat. Rather, balance your non-veg protein with fish, chicken, and little less amount of red meat. And people who are vegetarian, they need to take care of their supplements because sometimes they take their protein from lentil or soybean, that sort of thing, which needs to be added to their diet. So I think my suggestion will be, if you are thinking that you have a problem with your diet, you should consult a dietitian. And nowadays, very good dietitians are available in all these institutes and all the clinics which we run.
So the chat box is flooded with congratulatory messages. They are very happy to learn so much. The next question is, what do women who have entered menopause need to particularly check in a well-woman checkup?
Now, in a well-woman checkup, first thing is you are seen by a doctor. The doctor asks you a few relevant questions about your health, your family history. Especially if you have a first-degree relative who is suffering from breast cancer or ovarian disease like ovarian cancer, you need to be identified and you need to have a regular checkup on that line. Then if you have any particular health issue, you should mention that to the doctors so that we can modify our well-woman checkup list. Usually it includes a breast checkup like in the form of either ultrasonography of breast or mammogram. Then an ultrasonography of whole abdomen to see the vital organs inside as well as the uterus and ovaries. That also includes a pap smear of cervix for women who have their uterus and some blood tests which includes lipid profile, thyroid profile, hemoglobin, sugar, and sometimes some tumor markers if necessary. So most of our clinics like Bhagirathi Neotia, in our hospital and in our clinic, we have a well-woman package already made for you. You can just come forward. Either you can see a doctor and then go for it, or you can yourself directly go and ask for a well-woman checkup, and that is all ready and available in all these clinics.
So the next question is, how do we account for the speedy increase in weight gain between 45 and 50 years of age?
Meenakshi, can we just make this the
Yes.
last question?
Okay, ma'am. Okay.
Okay, now as I told you, with age, our metabolic rates change. 2, our lifestyle. More senior we get in office or at work, most of the places we tend to get sedentary. That means we do more office work than running around. And if you are not running around and burning your energy, your metabolic rate is slower. You are bound to have excess weight gain. So here comes the role of a dietitian and diet. And I will insist that with age, especially 40 plus, you modify your diet and bring exercise into your lifestyle. All the doctors, cardiologists, all the health workers, wherever you go, they will insist that you do 45 minutes of exercise at least 4 times in a week. And if you can do that and modify your diet a little bit, then you will see it will be much easier to manage the weight. Managing weight is not easy, it's very difficult. Once you tend to put on weight, you will find it is very difficult. It doesn't stop, or to shed weight, you really have to sweat well. So I think it's a hard work, but it can be done.
I should not take up any more questions, ma'am.
I think it is enough. Doctor is also
Okay.
getting tired. He can always
Yeah.
go back to her Bhagirathi Neotia for asking questions, because the discussion has been so invigorating.
Ranjana ji, before the vote of thanks, can I request you to ask everybody to have their videos on so that we can take a screenshot
Sure, with the doctor.
with the doctor? Yes.
Yes. Okay, so all members present, kindly switch on your cameras so that we will take a screenshot for our records.
Ambili, Harsha,
Everybody with the
Sanghamitra,
doctor.
doctor
And
is
then, of course,
already,
a formal
Dr.
vote of
Chakraborti
thanks.
is already
Dr.
there.
Chakraborti, I'm really
Deju,
grateful to you
Sudha,
for your wonderful deliberations.
Thank you very much, madam. It was my
Lots of
pleasure.
new areas have come into our purview.
Umar,
If
Sanghamitra,
there is
Sudha,
anything required, I'll come back again.
Deju, Uma, Anchan.
अच्छा नहीं अभी आपको रास्ता तो मालूम है ना you know
this was like tailor-made for us, I think, doctor's speech. It was very, very,
Thank you very much that you liked it, and I hope I
Is
could.
it done?
One more
Ravi,
screenshot.
is the
People
screenshot
have,
done?
no, 1 minute. People are just coming in. 1 minute. Ranjanati, once. They're just sauntering in. 1 second. Give me 1 minute, please. Yeah, okay. Thank you.
Thank you. Meenakshi, will you please do the formal vote of thanks?
Yes, ma'am. On behalf of IFWA, I extend my heartfelt gratitude to Dr. Ranjit Chakraborti, an experienced gynecologist who took up the various aspects related to the subject health crisis of women with special focus on hormonal imbalance and answered queries related to it. The talk was very informative. Thanks goes out to him for accepting our invitation to grace this event with his presence. He has given us various practical tips to maintain our hormones, which otherwise can play havoc in one's life in case of an imbalance. I'm grateful to our president, Dr. Ranjana Banerjee, for always supporting us and take up need of the hour projects. I express my gratitude to the office bearers of IFWA for promoting and attending the program. Thank you, my dear friends, for joining us virtually. It was an honor to have you all with us. We are highly obliged by your gracious presence. Good evening, and thank you once again.
Thank you.
Thank you, Dr. Chakraborti. Maybe next time once again.
We will always make another one. Thank you.
Thank you.
Good night.
Thank you, Meenakshi, and thank you, everybody. On behalf of IFUWA, we will meet again in the month of April.
Thank you.
Thank you, madam.
Thank
Ravi, you can close the program now.
Okay. Thank you, everyone. Thank you, doctor. Bye.
Thank you.
Bye, everyone.
Okay, bye. See you.
Bye.
Bye.